Okay, acute respiratory distress syndrome. It is a very sudden and progressive form of acute respiratory failure. You get fluid that leaks into your alveoli, and it makes it very difficult, if not impossible, to breathe. You have sudden, severe shortness of breath that can develop within a few hours or days after an insult or an injury. So anybody who has a sudden onset of severe shortness of breath is a priority patient that you would want to go see immediately. So if somebody tells you, hey, your patient in room 106 says they suddenly can't breathe, you would want to go down there and check on them as quickly as possible. Ards actually has a 40% mortality rate, so the risk of death is actually going to increase depending on your age or the severity of your illness. So a lot of times sepsis is involved in this. These people can be septic, which sepsis is like a whole nother bad thing. So the treatment, you're going to give them oxygen because they can't breathe. So oxygen is good for anybody that can't breathe. We may do positive pressure ventilation, so you may actually have to put them on a ventilator and provide that positive pressure. They may use PEEP. With PEEP, what that basically does is that during expiration, it keeps your alveoli from collapsing. It kind of keeps a little bit of pressure on your alveoli at all times. That's very helpful when you've got acute respiratory distress syndrome. We try to figure out what the underlying cause is. So what caused them to go into acute respiratory distress syndrome in the first place. We do hemodynamic monitoring, so we're checking their vitals. We're monitoring their nutritional status and making sure they've got good nutrition. You may be doing inotropic or vasopressor drugs to maintain cardiac output. You may have to give them diuretics. You may have to give them IV fluids. You may have to sedate them. You may have to give them pain medicine. It may be severe enough that they're on a ventilator and you have to give them neuromuscular blockers so that they don't fight against the ventilator. So there's a whole lot of different things that you may have to do for them. But the big thing that you need to know is that it's got a very high mortality rate. And so if you have a patient who develops ARDS, you just need to start talking to the family and letting them know how really severe this is.